Hello, my name is Casey LeBlanc, and I'll be talking to you about toxoplasmosis. Toxoplasmosis is a disease caused by the intracellular parasite Toxoplasma gondii. The parasite is estimated to infect 1/3 of the world's population, and it is ranked third for fatal causes of foodborne illness in the United States. The parasite undergoes sexual reproduction in cats, therefore allowing the infected cat to pass millions of oocysts with each bowel movement. After release into the environment, the oocyst undergoes sporulation and can contaminate water, soil, and food sources. Humans can become infected by consuming tissue cysts in undercooked meat and by ingesting oocysts on unwashed produce, contaminated water, or in a cat's litter box. Vertical transmission is a major concern for expecting mothers because, if infected during gestation, there is an approximate 30 to 50% chance that T. gondii will cross the placenta to infect the fetus. Another uncommon route of transmission is through organ donation and blood transfusions. Toxoplasmosis is an asymptomatic disease for 80 to 90% of individuals that contract it. For the remaining 10 to 20%, a flu-like syndrome can last up to several months before the parasite transitions into a dormant state and symptoms resolve. Infected patients may experience fever, night sweats, cervical lymphadenopathy, abdominal pain, rash, headaches, and muscle aches. Less commonly, patients can develop retinochoroiditis and will experience visual disturbances like blurring and floaters. If untreated, these lesions will lead to retinal scarring and eventual blindness. An array of manifestations can result depending on which body tissues the parasite invades. Over 2/3 of congenitally infected newborns are asymptomatic at birth, although they remain at increased risk for developing symptoms later in life. Nonspecific findings at birth may include rash, jaundice, fever, vomiting, abnormal bleeding, and pallor. Untreated infants most commonly experience vision loss in childhood, and they are at increased risk for optic growth, mental disability, seizures, and hearing loss. First trimester infection carries a more severe prognosis, and manifestations may include miscarriage, stillbirth, macrocephaly, or microcephaly. The signs and symptoms of toxoplasmosis have such wide variability that an astute provider must use the clinical presentation, results of all diagnostic studies, and a high clinical index of suspicion to narrow down the diagnosis. If a patient presents with unresolving flu-like symptoms and lymphadenopathy, the differential should include, but is not limited to, mononucleosis, lymphoma, tuberculosis, HIV, sarcoidosis, and cytomegalovirus. Initial testing can include a complete blood cell count, blood culture with smear, comprehensive metabolic panel, and heterophile antibody test for mono. All labs are commonly unremarkable. However, some patients exhibit lymphocytosis on the CBC and elevated liver enzymes on the CMP. To diagnose toxoplasmosis, T. gondii-specific IgM and IgG serologic assays using enzyme-linked immunosorbent assay, tissue biopsy, and cerebrospinal fluid analysis via lumbar puncture can allow for direct visualization of the parasite, although these invasive tests are rarely performed. Antenatal screening for congenital infection involves amniocentesis with subsequent polymerase chain reaction analysis of the withdrawn fluid. Contrast MRI of the brain can be used to detect ring-enhancing lesions or cerebral calcifications typical of this parasite. Treatment of toxoplasmosis is required if the patient is pregnant, immunocompromised, or if the infection is severe. The typical treatment regimen involves pyrimethamine and sulfadiazine. Leucovorin, a folinic acid analog, is included in the treatment regimen to counter sulfadiazine and pyrimethamine-related bone marrow suppression. HIV-infected persons with a CD4 count below 100 should take Bactrim daily for prophylaxis. Foodborne transmission can be reduced by cooking meat products to the proper temperature, thoroughly washing produce, boiling untreated drinking water, and cleaning kitchen utensils with soap and hot water. The risk of environmental exposure can be reduced by performing frequent hand hygiene, limiting travel to third world countries, and avoiding stray cats. Additional cat precautions include keeping domestic cats inside, performing daily litter box changes, and avoidance of handling cat feces when pregnant.